Hi, good morning. I am Dr. Haradan. Today, I would like to speak on a particular subject called syncope or fainting or sudden fall with transient loss of consciousness with immediate recovery. This is quite common in the population and it occurs in around 20 to 40 per thousand people. Basically, it's of three types. One is a vasovagal syncope due to some anxiety, pain, or stress, or some special situation like coughing, sneezing, lifting a weight, or urination, defecation, or any such things which would cause a neurally mediated syncope. That's quite common in young people. Okay. And secondly, there is a condition called cardiac mediated syncope. This is especially due to problem in the heart muscles, in the rhythm disturbance of the heart, cardiac arrhythmias, blocks, or atrial changes or ventricular changes, or problem in the valves like aortic stenosis, or something what you call as a hypertrophic cardiomyopathy, or a dissection of the aorta, or even embolism to the pulmonary artery. So, these are the conditions where you can have a syncope due to cardiac cause. There are so many ECG abnormalities which would masquerade, which would present as a syncope like Brugada syndrome, or Wolff-Parkinson White syndrome, ventricular tachycardia, ventricular fibrillation, various blocks, sixth-sense syndrome, many such cardiac conditions are there that roughly constitute around 5 to 10% of the total syncope population. All right. The large chunk of the population is the vasovagal syncope that usually occurs in young people who are exposed to painful condition or stress or emotionally charged, if they see some things which they are not used to, not exposed to, or when they touch these areas, some people will have a hypersensitive carotid sinus. When they use a tight collar, or if you use a tie and they can even develop the syncope and fall. So those people, it is better to avoid using a tight collar. All right. Then there are people who used to lift weight and get a syncopal attack, or after defecation, urination, coughing, sloughing, sneezing. So any of these things can give rise to a reflex neurocardiogenic syncope. Then there is a condition called orthostatic hypotension. That means when you stand for 2 minutes or more, or if you are in the queue, or if you are doing something, the blood pressure to the brain can drop dramatically. So instead of the 100 to 120, it might come to 90, 80, 70, or even lower. This would disturb the blood flow to the medulla or to the brainstem. That would lead to sudden fall, loss of consciousness, and once they are in the supine or in the horizontal position, they immediately regain consciousness. This is the classical symptom of a postural hypotension. This occurs basically in people who are elderly, those with multiple cardiovascular risk factors, those with cardiac involvement, hypertension, those who are on medication like diuretics, centrally acting antihypertensives, vasodiuretics. So any drugs which would dramatically drop the blood pressure. Also, in those cases, if they continue to experience this sort of syncopal attack, you have to change the drug or to substitute some other thing and address properly regarding what to do during a syncope like that. All right. Secondly, there are certain conditions called diabetes with involvement in the nerves called autonomic neuropathy, or Parkinson with autonomic involvement, or some other Parkinson plus syndrome, or there are conditions called amyloidosis, or paraneoplastic, or this HIV, vasculitis. So any of this condition can involve the nerve system, especially the autonomic nerve system. So what happens then, when they assume a erect posture, maybe for 2 minutes or longer, this would lead to sudden fall and loss of consciousness, and they can have injury, fractures, and other things. So basically, when once you are upright, usually they can be fall up to 10 to 20 millimeter of blood pressure in the systolic and around 10 millimeter in the diastolic. When it exceeds 20 millimeter in the systolic or 10 millimeter in the diastolic, is called a postural hypotension. This may be symptomatic or asymptomatic. In the asymptomatic, it can be up to 30 millimeter systolic and 15 millimeter diastolic. All right. And there are so many other endocrine problems like hypopituitarism, hypoadrenalism, or salt losing nephropathy, or renal condition where the salt is lost through the urine. In those conditions, you have to you have to treat accordingly, and you should advise the patient to avoid further syncopal attack and falls. Okay. So, what are the differential diagnoses? Like suppose somebody is falling, it may not be a syncope at all. This may be something else. Maybe say a problem in the brain, what you call the vertebrobasilar stroke. Usually in vertebrobasilar stroke, there will be associated symptoms like double vision, facial drooping, or difficulty in speech, or numbness of the face, or difficulty in swallowing, difficulty in phonation, or weakness of one or both sides, or difficulty in ambulation, visual disturbance, memory disturbance, unsteadiness. Usually just by fall and loss of consciousness, we usually don't consider this as a vertebrobasilar stroke. So, secondly, there are the Stokes-Adam syndrome due to various cardiac causes that I have already mentioned. Then we have certain anxiety related to fall and non-organic seizures. Sometimes hypoglycemia, low sugar can give rise to syncope. Hypoxia can give rise to syncope. Pulmonary embolism can cause the patient fall and lose consciousness. And any of these neuropathies, autonomic neuropathies, due to lots of conditions are causing autonomic neuropathies. All right. So, there is a condition called subclavian steal syndrome. That means there is one artery to the actually there is one artery, this is called subclavian artery below the clavicle. This supplies the hand, the upper limb, as well as the brain through one artery called the vertebral artery. Sometimes there can be a blockage of this subclavian artery proximally, and once they do some exercise like doing something with the hands, the working hand will draw blood from the brain. Since this is already ischemic, the proximal ischemic, they draw the blood through that artery called the vertebral artery from the brain, which would lead to a vertebral ischemia, especially during working with the hands. Recently I had a patient with who was a carpenter by profession. When he was doing this sort of continuous work, he gets headache, he gets a vertiginous feeling and falls down and syncopal attack. So, you have to consider syncopal attack in the context of a subclavian steal syndrome also. So, basically you should evaluate these patients, or you have to undergo certain tests like blood tests, look for anemia, hypoglycemia, or electrolyte hyponatremia. When ECG, look for any cardiac rhythm disturbance or myocardial cardiomyopathy or myocardial infarction. All right. And any endocrine profile in case patient getting fatigue and low BP most of the time. So, you have to have an endocrine profile, blood test, ECG, maybe echo. You have to consider a cardiologist and evaluate for any secondary or cardiac cause for syncope. All right. And if there is if the syncope is due to low blood pressure due to multiple drugs, you have to modify the medication, and you may have to add extra salt. You should use a elastic bandage or abdominal binders, and avoid immediate ambulation when you get up in the morning. Like you have to sit in the cot and do some stretching exercise, and whenever you feel like fainting, never ever stand. It's better to sit, immediately sit, and try to squeeze with your both hands or squeeze both thighs, and try to squat on the floor with the head in between your your legs. And the best thing is you keep in the supine position, go to the bed and lay in the bed, and never ever help people with the syncope to make them stand, because if you make them stand, it's possible that they can get a fit. It's called a convulsive syncope. So, it is not advisable, because already the brain is deprived of blood flow. So, if you make them stand for another 1 minute or 2 minutes, the brain can get damaged, and sometimes it can lead to more stroke or more damage to the person. So, whenever somebody is having a fainting or something, always keep them flat on either on the floor or on the bed. All right. Secondly, if there is a cardiac problem, probably you may have to use you want to consult the cardiologist, and they may advise for prolonged Holter monitoring. And if the rhythms are abnormal, we may have to do a pacemaker or an implantable defibrillator. All right. And if there is a endocrine abnormality, you may have to use cortisol or other medication. For people with a salt losing nephropathy, we may have to use more salt or and treat the basic condition. And for autonomic dysfunction, we may have to use short course steroid, like not short course, long course fludrocortisone or medodrine and other supportive care. All right. So this is in short regarding the syncope, though it's very common in the population, and you should know that it's a fainting and not a major problem like attack or something like that. So we may have to evaluate, or you should undergo evaluation to avoid a further catastrophe. And if it's a mild one, of course you can be relaxed, and if it's a major one, of course you can treat and it can be better. Thank you very much. Bye.